Welcome to the Hamilton Chambers of Commerce's Small Business Week webinar series, proudly hosted in partnership with our friends at Economic Development. And today's seminar is brought to you by our friends at Skyway Insurance and Chamber Plan. For those of you I haven't had the pleasure of meeting, my name is Greg Danette, and I am President and CEO of the Hamilton Chamber of Commerce. This is such an important week and aspect of our chamber programming because small businesses are the backbone of our community. They drive innovation, they create jobs, and they help make Hamilton such an incredibly vibrant community to live, work, and play in. This webinar series that's running all week is designed to provide valuable insights and practical tools to help support our small business community. Additionally, we're 2 weeks out from Hamilton Day, which is our big shop local event, and if anybody is looking for more information, or if you haven't signed up yet, go to hamiltonday.ca, but it runs the weekend of November 2nd to 3rd. But all of that is filling for what comes next. And it is my absolute pleasure to introduce registered psychologist Eva Storti to present on stress and resilience. This presentation is so important coming up to the holidays. I have to, speaking frankly, we have a person in our family who suffers from seasonal depression, and so I'm going to be listening very acutely, and I'm super excited to have Eva talk. So Eva, on behalf of the Hamilton Chamber of Commerce and all of our members, thank you for joining us today. Welcome, and I will turn the proverbial microphone over to you.
Oh, wonderful. Thanks very much, Greg. Thanks for having me today. So yes, my name is Eva. I am a psychologist. I'm based in Calgary, Alberta. I have a private practice here, and I'm also the clinical director for Arcora. So Arcora, we've recently rebranded in October. Our name previously was Arete. Some of you may have heard that before. Folks who are chamber members have the option to opt into the group insurance plan. When they do so, they are automatically opted into our business assistance services. We also have an additional suite of solutions under the EAP umbrella. And so that's a bit about who we are and kind of where I'm coming in from today. So before we begin, I certainly like to honor and acknowledge the traditional territories upon which we gather today. I am grateful to the traditional owners and caretakers of this land, including but not limited to the First Nations, Métis, and Inuit peoples who have stewarded these territories for generations. So at Arcora, we pledge to listen, learn, and work together in a spirit of truth and reconciliation. A very small disclaimer is also that the content of this presentation is psychoeducational. It doesn't constitute formal medical advice, and it does not imply a therapist-client relationship. So I always recommend to consult with your specific professional who's involved with your specific needs. Let's dive in. So a quote from Carolyn Aldwin's Culture, Coping, and Resilience to Stress. Stress or suffering is ubiquitous, both in a scientific sense as well as a personal or social one. In terms of science, the past few decades have seen nearly 80,000 papers published on the topic, ranging from the effects of stress on the genome, cellular functioning, to its impact on physical and mental health, to the effects of stress on a social and cultural level. Psychosocially, it's also ubiquitous. At some point, all humans will suffer illness, bereavement, and death, and most will suffer stress in their family, work, or spiritual lives. Some will suffer from poverty, hunger, or torture. In many ways, it's how we cope with stress or our resilience to it that determines our level of happiness. Psychologists describe resilience as coping skills, social support, and temperament. But anthropologists remind us that how societies and cultures are organized also has a great impact on both the nature and types of stressors that people face in their daily lives and the types of resources we can draw upon. In our presentation today, we'll focus certainly on defining stress and resilience. We'll go over some really important topics specifically for this time of year, seasonal affective disorder and the holidays and how that affects our mental health. I will go over organizational considerations as well for specifically how this shows up in the workplace and how employers and employees can foster either stressful work environments or resilient work environments. And we'll spend some time really on how to cope with this. So I encourage participation in the chat. I can't actively see it, but Greg and Jose are going to monitor that for me. And I will have time for Q&A certainly at the end, or they'll let me know if there's something really pertinent that I can answer throughout the presentation. Let's dive into stress. In psychology, stress is defined as a feeling of strain and pressure, a condition that seriously disrupts the physiological and psychological balance of an individual. Richard Lazarus, he's an American psychologist who studied what's called the transactional model of stress, defined this as a transaction between the individual and our environment. So essentially, anything that taxes or exceeds an individual's resources is considered stressful. For Lazarus, how an individual appraises or views a situation determines whether or not it's considered stressful. So appraisals are a function of both context that we're in, as well as our personal characteristics. And we know it's also not just emotional and psychological, it's neurobiological too. And what that means is that there's certain brain regions involved in stress and resilience. We know from a recent survey that 25% of Americans reported high stress and 50% identified a major stressful event, even in just the last year. So there's 3 distinct types of stress according to the American Psychological Association, and they'll all affect us in slightly different ways. Acute stress being the most common, essentially just from demands and pressures of the recent past or anticipated demands and pressures of the near future. This can actually be pretty thrilling in small doses if you like to do a fast run down a ski hill, for example, but it can also be draining. It could be a tight deadline or a traffic jam, for example, which don't feel so great on our system. Episodic acute stress is when acute stress occurs on a fairly regular basis or reoccurring episodes. So I think of medical professionals, for example, who work in an ER department, or you might have someone who comes to mind that's always rushing in late. So I consider that there's a lot of sort of recurring stressful factors in these people's lives. Chronic stress. I guess an analogy here would be if acute stress is a stubbed toe, we could consider chronic stress more like a toothache or a slipped disc in our back. So it's hard for it to resolve without an actual intervention. This can be deep-seated, this can be persistent. We might consider this the stress of an unhappy marriage, for example, significant debt, or a really difficult career that can go on for years. So this is a essentially consistent period of time. And while this is not part of the APA's above definitions of stress, traumatic stress is a 4th category that I thought was worth mentioning. Its more formal name from the Diagnostic and Statistic Manual of Mental Health Disorders is post-traumatic stress disorder. So this is a mental condition triggered by a significantly stressful event that we've either experienced or witnessed. And the negative impact is of a clinically significant nature. So it meets the criteria for a diagnosis, essentially. Excuse me. Let's get into stress a little bit more. Small amounts of stress, I think it's important for folks to understand that this can be beneficial, even desired, and healthy. Some examples would be running for exercise. That's stressful on your body, but it's considered healthy. Traveling for me is rather stressful these days, especially if you have small kids. But we could say that that small amount of stress might be beneficial when we get to our destination. A positive stress, we could call it positive stress. And so this helps us generally improve our performance as well. It also plays a factor in motivation, being adaptive, and being able to be flexible in reacting to your environment. Excessive amounts of stress, however, may lead to harm. So this can actually increase the risk of strokes, heart attacks, ulcers, and mental illnesses. So managing stress becomes important because we know that there's a link between genetic predisposition and life stressors in how we develop potentially mental health disorders and other physical conditions. So in short, I think it's important for folks to understand that it's holistic. Stress can be an inducing factor in declines in our mood, health, and general well-being, and it can affect your body, your thoughts, your feelings, and your behavior. Quite a few different signs of stress and how this presents for different people. Know that it's not a one-size-fits-all approach, but we can look at the different cognitive, emotional, behavioral, and physical domains of how stress may present in our body. Some people will get sick, in this physical domain. Other people will reach towards different behaviors that are helpful or harmful. Some people can experience difficulty regulating their emotions, and cognitively, stress can affect essentially how we process information in the world. A bit about this stress arc. So there's been a lot of research on this topic. A psychologist by the name of Yerk Dodson calls this the inverted U, which is the relationship between stress or anxiety and specifically performance. And so what I like about this is that the goal is, if you can moderate your stress, if you can get to that, literally the medium level of stress of 5 out of 10, you actually achieve your peak performance right here. Okay. So often in my work that I do with clients, our goal is not to get to a place of 0 out of 10 stress necessarily. We might actually have some negative affect down here, such as disinterest and disengagement. But if we have sort of this moderate level, we're performing at our peak. Okay. Obviously, the goal is to optimize this reaction here so that it can serve us instead of harming us, obviously, at this extreme end of the spectrum. So don't worry. I mean, I'm not saying that you have to be happy, if you're let go unexpectedly from your job. That's not the expectation here. But I am saying that the resilient mind and the resilient individual will naturally find the opportunity in that. And a person who is operating with a closed mind or a less resilient outlook, we also call this a growth mindset versus a fixed mindset, will see this purely as a failure. And so your first coping tool for the day, know that in every challenge, there could be an opportunity for growth. So let's talk about essentially like how stress presents in our lives and what factors play a role in our predisposition to stress. So I talked originally about neurobiological or neurochemical factors. So specifically, we have neurochemicals in our system: serotonin, dopamine, and cortisol. These are mood affecting and stress levels of neurochemicals in our system. So naturally, people can have different brain chemistries, and those with chemistries that are more resilient or less resilient to stress is going to sort of predispose somebody's natural first state and first intuition and first response towards a perceived stressful event. This is determined both genetically and developmentally. So that means nature is a determining factor as well as nurture, certainly in our early years. And there are reward and punishment factors as well in developing stress. And so it has been found that individuals who have, for example, a purpose in life, they tend to have higher levels of well-being and lower levels of negative symptoms. So when a person's highly motivated to fulfill their purpose and their passion in life, stress can be easier to overcome or accommodate. I think about people who are entrepreneurs and starting their own businesses. Obviously, it's a pursuit that they believe highly in because it certainly isn't easy. And they have a high level of resilience, I think, to the stresses of starting a small business. So reward symptoms that naturally maintain healthy baselines help us to be more resilient. So other brain regions, we have a prefrontal cortex. This is the part just kind of in our forehead here. This plays an important role in setting goals and guiding our overall behavior. maybe discriminating between rewards and punishments, and also demonstrating affect. Our effective working memory also allows someone to anticipate a positive outcome, a feeling outcome, and engage in behaviors towards that reward, obviously, and avoiding punishment. And so if we have deficits in this prefrontal cortex of our brain, we will struggle with our stress management. So think about delayed gratification, for example. If we can't delay gratification because that's too stressful for us, we're going to operate in a much more reactive, impulsive way. Our nervous system plays a role in how we interpret stress. So during situations of danger, we have a sympathetic nervous system that releases epinephrine, norepinephrine, and adrenaline. This is a protective mechanism. Everybody's body does this. But the magnitude of the sympathetic nervous system response to danger will vary from one person to the next. And some people have overactive nervous systems. Now, our nervous system can shoot us into a state of what's called either hyperarousal or hypoarousal. So you'll see that in the window of tolerance here. And know that this optimal window, we call this the window of tolerance, is an optimal place for us to function. But naturally, we'll shoot up and we'll shoot down. If we can return to this state of our window of tolerance relatively quickly, we're going to have a better, obviously, reaction to our stress. Okay. So this is kind of like a nice visual of how this can show up in our lives. A cognition or cognitive appraisal of events. So this just means how we perceive things, how we choose to interpret experiences. Oh, it's the first snow day here in Calgary. I can choose to interpret this with stress and, pessimism, or find the gratitude in the changing of seasons, for example. Social, cultural, and environmental determinants. And so this is really, I just want to point out that there's differences noted outside of Western culture. You'll see this, for example, in immigrant populations who might experience a culture shock related to change and transitions, or you might notice this in different early life experiences. So it's just important to note that culture shapes both normative stressors and individual responses to them. So not everybody's going to perceive the snow day, first snow day of the year, the same way. Essentially, to summarize, there's lots of factors that differentiate individuals who can tolerate or even benefit from stressful situations to those who might develop symptoms as a result of the same situation. So psychologically, personality, cognitive appraisal, and behaviors are all contributing factors. This doesn't affect everybody similarly, okay? And so some people will land in different states of arousal. Based on that, you're going to need some unique coping skills tailored to your situation, essentially. Okay. And we do notice that these differences exist across age, sex, and culture. Nobody is immune to the effects of stress. Here's what I like to do next, because I just stressed everybody out by talking about stress and how we can be affected by it. I like to do a brief body scan. Nobody's looking at you, your cameras are off, so you can go ahead and close your eyes if you feel comfortable doing that. And I invite you to take a deep breath in through your nose and then out through your mouth. Notice how your body feels right now. Starting at the top of your head, gently scan down through different areas of your body. Notice what feels comfortable and what feels uncomfortable. We're not trying to change anything. We're doing a non-judgmental checking in on our system and bringing our awareness inward. Notice your body's sensations as you scan down evenly, all the way down to your toes. So after getting stressed out, you all deserve to learn about resilience and coping, which also are natural human characteristics. So while we have the capacity for one, we also have the capacity for the other. Resilience refers to the ability of individuals to adapt successfully in the face of acute stress, trauma, or chronic adversity, maintaining or rapidly regaining psychological well-being and physiological homeostasis or balance. Resilience can be conceptualized as the strengths and benefits obtained from coping successfully with a trauma or a stressor, or the extent to which an individual's coping mechanisms buffer against stress prior to and during stressful events. Resilience, of course, can fluctuate due to changes in perceived stress or even changes in physical environment. Psychosocial factors associated with stress resilience include positive emotions, optimism, humor, cognitive flexibility, a cognitive style that can reappraise or re-perceive situations, acceptance, religion and spirituality, altruism, social support, role modeling, exercise, coping styles, and the capacity to recover from stressful events and stress inoculation. So cultivating resilience really reflects, I think, active decisions, quite frankly, that orient people towards wellness and health. Resilience can be established through self-care, through stress management practices, and there is such a thing as post-traumatic growth. So this is resilience that can grow out of overcoming a stressful experience. The research has demonstrated higher job satisfaction and lower levels of job stress and burnout with people who demonstrate resilience. At our Cora, it's incredibly important to us to understand the impact that our services, specifically our EAP and mental wellness support services, have on clients who access them. So in 2021, we published a report specifically on resilience. So this study basically assessed clients' resilience, so people's ability to bounce back or recover from stress and adversity before and after using our EAP service. So despite a major focus on research and knowing that resilience can have a big impact on one's ability to perform their job, little has actually been contributed on the effect of EAPs specifically on resilience. So it was important for us to look at this in that regard. So we used a pre-test and a post-test design with our clients and a resilience index, and not surprisingly, the results were favorable. I shouldn't say obviously, but people benefit from support and learning tools for resilience. So an average increase of 16 to 21% on the resilience index by the time counseling was complete. If you'd like to see the full report, please just reach out to me. More on building resilience. So we can look at it under similar domains as we did stress. What I like about this visual is that it talks about flexibility actually in all four of these domains. And the coherence is really just these domains kind of coming together where people are not omitting any one place excessively. So the flexibility really, to me, also speaks to what's called neuroplasticity, which is the ability for our brain to change, the ability for our brain to learn new patterns and new networks. The same way that we would learn a new language, we can learn stress coping skills and resilience building mindsets. So a little bit more on how we can build this resilience. Obviously, I'm a psychologist. For me, it's important that we're treating any contributing factors. And so if there's a mental health concern, if there's a diagnosis of generalized anxiety disorder or depression, of course, that's going to, be a foundation that impacts our ability to build resilience. So it's important that those contributing factors are identified and treated. Medications will treat some of the neurobiological factors that I spoke about earlier, so the neurochemicals in the brain. Things like SSRIs, selective serotonin reuptake inhibitors, they naturally just leave more serotonin in your brain, which is one of those reward and mood altering neurochemicals. And so that may enhance resilience in individuals who are vulnerable to low levels of serotonin in their brains. Treating negative childhood influences and other traumatic life events. I'm a trauma-informed therapist. Developmental traumas will affect our perceived belief, even just in the world, that the world can be a good place and we can be resilient to other stressors that come our way. Relaxation techniques and cognitive behavioral therapies help regulate stress, and mindfulness practices. Thus why I did a body scan partway through the presentation. It's important that we're also practicing what we're preaching, and just teaching folks about that, I think, is a really tangible way to connect with how this can feel in our body. Protective and preventative factors. So these can be both internal or external. Prevention can come essentially when we're just noticing that we're at increased risk. A preventative or protective factor would be like putting winter tires on my car before the first snow day so that I'm not stressed out driving on the icy roads. Do you think I did that? So, excuse me. Locus of control. Locus of control means essentially, do we see ourselves as the driver of our own bus or as a passenger? Resilient people are going to see that they have more control in the outcome of their choices, rather than sort of the world happening to us. So that can play a factor in our feeling of resiliency. Emotional regulation in general. Holistic self-care practices, anything that attends to sort of this mind, body, spirit triad, to sort of treat our stress is going to boost resilience. Negative emotional states don't feel good, you know, and for a lot of us, we're just going to try to push these emotions away. But I really encourage folks to understand that emotions are information, and even stress, again, we're not looking for a 0 out of 10, you know, on the rating scale. Stress is going to inform us that it's important that I drive with care on icy roads, right? If not, I'm just going to speed on my way to work and risk, you know, something happening, let's say. So it's important information that we're still attending to. And it's important to meet ourselves with self-empathy. When we're doing a body scan, part of my mandate is that we're not judging what we're noticing in our body, whether it's comfortable or uncomfortable. So meeting ourselves just with empathy, with neutrality, with understanding, certainly gives you a lot more space to experience stress or resiliency. Boundaries are important. There are many different types of boundaries that help us be more resilient and increase our resilience. So we have physical, emotional, time, sexual, intellectual, financial, and material boundaries. Exercise, obviously, even a 15-minute walk might be good enough to reboot. It's an evidence-based, as effective as medication treatment for depression. Enhancing our social networks certainly builds resilience, and using adaptive coping strategies, I'll speak to that a bit more. And specialized therapies, cognitive behavior therapy, interpersonal psychotherapies, exposure therapies, any treatments for PTSD. These are certainly going to help you build that resilience factor. So a little bit on coping. So essentially the goal is that we're minimizing the impact of stress here, using a little bit of humor to cope on this slide. There is such a thing as what we call maladaptive and adaptive coping. So essentially people cope differently, but coping doesn't always mean that we're coping well. Maladaptive coping is something that's going to decrease stress temporarily, but it just doesn't solve the problem, or it has negative consequences associated with it, such as escaping through alcohol. Adaptive coping, on the other hand, is going to legitimately help us face our fear and solve our problem. And it doesn't have any negative consequences associated with it. So, having creative hobbies, practicing meditation, setting boundaries, things like that. Exercise, but not excessive exercise, because that could become maladaptive. So think of it sort of on a balanced spectrum. There's also active versus passive coping. Active is when we're dealing with a direct challenge or fear, whereas passive might be a bit more like avoidance strategies. So again, maladaptive strategies can help, but technically they're going to be short term. What's helpful is when our coping strategies are flexible, when they're responsive to the specific situation. We can modify old ones, we can learn new ones, we can put things into perspective as well. I think it's helpful to consider, challenges that we've overcome in the past and how we've overcome them, and acknowledge, hopefully, that there's been some growth in that. Usually there are many ways that we're coping in a given day. So let's try this. Let's do some coping.
So sitting comfortably, just taking a big deep breath in through the nose, out through the mouth. As you breathe in, noticing how the body expands. As you breathe out, just watching the body soften as you gently close the eyes. And rather than the mind leading the breath, allow the breath to lead the mind. Notice the sensation of the breath. Notice it where you feel it in the body. If you need to, you can just gently place your hand on the stomach. And just following that rising and falling sensation. Nothing else to do. Allowing thoughts to come and go. And when you're ready, just gently opening the eyes again.
Part of what I like about coping is that it's contagious. Stress is contagious and coping is contagious. When one of us regulates our nervous system, it's going to help other people around us to regulate their systems as well. So again, if you were to check in with your system and do a body scan at this point, now that you've learned about resilience and everybody's natural capacities for coping, you might notice that your body scan feels a little different. Again, it's a non-judgmental checking in, noticing any areas of comfort or discomfort from your head all the way down to your toes. And just acknowledging and bringing that awareness inward for a moment. Excellent. So we're going to dig just a tiny bit deeper into two topics that are relevant at this time of year. This might be a good place for me to pause and also check in if there's any relevant questions popping up. Greg will unmute himself and let me know. Don't hesitate. So we're going to dive into the winter months, specifically seasonal affective disorder and mental health, stress, and resilience over the holidays. We're going to blink and it'll be here. So specifically, seasonal affective disorder, or sometimes referred to as winter depression, is a type of depression that's formally recognized mental health condition. So in other words, the DSM-5 or Diagnostic and Statistic Manual of Mental Health Disorders calls it major depressive disorder with a seasonal pattern. So in this case, SAD or seasonal affective disorder involves mood changes and symptoms very similar to depression. We're going to feel low, depressed, and generally helpless. A lot of fatigue during the day and generally needing to sleep longer. Trouble getting up in the morning, difficulty with concentration. We might withdraw socially and experience a loss of pleasure in our interests. Usually we'll experience a loss of libido, impact on our interpersonal relationships. Some people will be more irritable, have more tension, stress, and anxiety just showing up during these months. Some people will crave carbohydrates, maybe waking up in the night to eat or experiencing weight gain. And some folks will experience feelings of despair, guilt, and worthlessness, or even suicidal thoughts. Seasonal affective disorder is typically experienced in a seasonal pattern. It comes in the winter months when people are exposed to less natural daylight, and it decreases in the spring and summer. So the majority of people who deal with seasonal affective disorder live in northern and southern hemispheres, or places that experience longer hours of darkness during the winter, and is much less common in people living near the equator. It's more than just the winter blues, you know, for the average person. So the symptoms can be distressing. They can be overwhelming enough that they interfere with our daily functioning. And it's important to know that it can be treated. So about 5% of North Americans actually experience this disorder and report that it lasts for about 40% of the year. Two distinct factors are linked to seasonal affective disorder, specifically the sunlight that guides our circadian rhythm. So this is our indicator of our sleep and wake patterns. The lower sunlight that we have, our body's biological clock and circadian rhythm becomes disrupted. And then serotonin and melatonin level disruption. So essentially both of these neurochemicals drop. This is also triggered by less sunlight. Melatonin is our natural hormone related to sleep, and serotonin affects our mood. So similar to stress and resilience, there are factors that increase vulnerability. Age. So generally risk decreases with age, and the highest incidence is among those 18 to 30. Gender, women are more likely to experience seasonal affective disorder than men. And location, rates are higher in parts of the world with less sunlight. If you work outside, you know, allowing you to get more sunlight, that's one of the factors that might decrease your risk. If your office can have big bright windows, consider that. We spend a lot of time in our offices sometimes during the day. And family history can also increase our vulnerability. So genetics do play a role in mental health disorders in general. If you have a family history of seasonal affective disorder or other types of depression, then you might be at higher risk for developing it yourself. This is where preventative coping factors come in. If you do feel like you are experiencing symptoms of seasonal depression, you know, it's important to seek the help of a trained medical professional, because just like with other forms of depression, you know, you want to make sure that there's no other medical condition causing the symptoms first. Seasonal depression can be misdiagnosed, you know, if there's other conditions going on, things like hypothyroidism, hypoglycemia, diabetes, viral infections, you know. So it's really important that people are getting a proper medical evaluation first. Once medical and physiological factors are ruled out, then a mental health professional can diagnose the condition and discuss basically some treatment options. And with the right treatment, it certainly can be a manageable condition. Treatments generally include light therapy. So specific light boxes or SAD lamps, you may have heard of these, either throughout the day, for example, positioned at your desk for a number of hours just to extend light exposure. Or some people will use this at a higher amplitude of light for a shorter, more purposeful period of time. For example, 30 minutes, usually right upon waking. The sunlight, basically, that light therapy imitates helps to trigger the release of serotonin in the brain, helping to improve your mood and build up stores of natural melatonin that your body uses at night. So it takes a whole day to build up enough store of melatonin, which is why sunlight exposure first thing in the morning is really important. So when you do have an opportunity and the sun does rise, you know, I'm always telling clients to put your eyeballs in the sun, because if it's on your back, you're still in the shade and you're not getting, I don't think, that input that your brain really requires by turning toward the sun and really absorbing that light exposure, or light therapy if you're using a sat lamp. Talk therapy is a common treatment. So cognitive behavior therapy is an evidence-based treatment of choice for depression. And that can help us essentially change the thoughts, behaviors, and feelings associated with the low mood in the winter months. Medications, so again, you know, SSRI antidepressants or tricyclic antidepressants, these can be taken only during the winter months, and these can be prescribed by your family physician or general practitioner. Some folks will stay on medication year long, essentially to prevent any potential relapse, you know, the following year. But best to have a conversation with your medical health practitioner about that. Exercise, I mentioned, is known as an antidepressant because it boosts our serotonin. And time outdoors. Eating a well-balanced diet is also part of that holistic well-being and treatment of seasonal affective disorder. You know, food affects our mood. And if we're eating poorly during the winter months, it's just going to add on to the factors that make it a bit more difficult. And then that healthy social network. Oh, it's really easy to isolate and hibernate during the winter months. So, you know, I'm not that familiar with what's in the surrounding area of Hamilton, but we can get out and ski here in Calgary and ice skate and play hockey. And that's always a big part, I think, of maintaining a social network during those months when it's easier to stay indoors. And maybe it is staying indoors and playing cards, you know, but still connecting with folks, I think, is certainly important. So while symptoms will generally improve on their own with a change of season, you know, it'll get better faster with treatment. And again, we can continue our treatment throughout the summer season to prevent relapse and maintain the benefits. So a little bit on the holidays. I like to give a small disclaimer here as well. These celebrations are unique, they're personal, they're nuanced, they're dependent on many different cultural contexts, traditions, locations, and histories. So when I say the holidays in this presentation, you know, I really want you to, it's just a starting point. I encourage you to just expand your view of what the holidays mean to you and others as we go through this next section. So when I talk about Christmas, I'm fully aware that it's not Christmas for everyone. So I'll dive into this a bit. You know, according to the American Psychological Association, there's quite a bit of research on this. 38% of people surveyed said that their stress increased during the holiday season. So typical reasons are things like lack of time, financial pressures, gift giving, family gatherings. Sometimes increased stress during the holidays can even lead towards physical illnesses, depressions, anxieties, and even substance misuse. So it's important to consider that if you're already living with one or more health conditions, you know, holiday stress can certainly be a trigger to make things even more difficult. The National Alliance on Mental Illness noted that 64% of individuals living with a mental illness felt that their conditions worsened during the holidays. So if we didn't talk about this, you know, again, thinking of it from a preventative lens, you know, we'd be missing an important piece over the next couple of months. Some people might mistakenly write off signs of serious depression as mere holiday stress. So I guess my counsel on that would just be if your symptoms are continuing for weeks or months, you know, if the intensity, we always look at the intensity, the severity, and the intensity, the frequency, and the duration. And so if this is interfering with your job or your home life, you know, and it's really sort of feeling unbalanced, then it'd be important to talk to a doctor, you know, or a mental health professional at that point. You know, specifically the impact of the holidays will vary, but there are common reported issues. And lacking the holiday spirit can feel like a lot of social pressure and a bit of stigma associated with the sort of Grinch mentality. It's not uncommon to feel overwhelmed by grief or loss or loneliness during this time. The holidays can highlight everything that has changed in a person's life. You know, it's generally a time when there might be increased busyness of the season, expectations around family, schedule, routine changes, and all of these things can be part of what makes the holidays more difficult and more challenging. In a lot of cases, you know, if there's no underlying mental illness, the symptoms can be considered temporary. Um, but if you don't look after your mental health and you experience symptoms that last, you know, over 2 weeks, consider talking to someone. Um, what you wouldn't want is for the holiday stress to sort of snowball. I call it a snowball effect into developing, you know, a mental illness if it kind of goes unattended to. So yeah, I mentioned, you know, a divorce, death, toxic family members, things that we try to avoid during the rest of the year, sometimes get exacerbated over the holidays. So a lot of assumptions we'll make around the holidays of how we should celebrate. It may not be appropriate to assume that everyone has the same traditions or that we have happy families to celebrate with. So this could be a privilege for some that is not available to all for various reasons. You know, that uniqueness in how this impacts everybody's lives, I think, is an important consideration. So how do we manage this? Setting realistic expectations. What this means really is that it can be helpful not to compare the current year to years past. Understand that life changes, and setting realistic goals for yourself and what your life is this year might be appropriate. It may not mean that this holiday season is its best, but it might be the most realistic that it can be. Not relying on drugs and alcohol to sort of help us to cope. Alcohol is a natural a depressant, and so not antidepressant, depressant. And so while you might feel temporarily relieved in the moment if you're consuming substances, know that it isn't a long-term fix. According to the Anxiety and Depression Association of America, there's a 20% overlap between anxiety, mood disorders, and substance abuse. So try to keep following your healthy habits. Don't abandon what you already do throughout the rest of the year that's healthy and productive. So try to eat those healthy meals, exercise, and practice that mindfulness that I taught you today. Try to plan ahead. And what that means is just set out space for your responsibilities and for yourself so that you're not rushing to complete everything. Establish plans in advance, and that helps you to feel prepared. It's okay to say no. You know, the holidays are very busy and we tend to have full schedules, and there can be pressure to say yes to everything. So learning how to say no and practicing those healthy boundaries, giving yourself time to relax and decompress, or even just saying no to, let's say, certain topics at the dinner table, you know, and let that might be uncomfortable or contentious for the family. So don't be afraid to take space for that. And there can be very respectful ways to say no and set reasonable boundaries. Acknowledging your feelings over the holidays. So while there might be many reasons to feel upset, you know, just know that it's okay to feel this way. This is that self-compassion piece that I was talking about earlier. It's important to let yourself know that your feelings are valid, no matter where they're landing on the spectrum. Reaching out for help with a trusted family, with a trusted professional or family and friends. Consider this sentence: it would help me to feel supported if you did an action, a specific action. And so don't be afraid to ask for what you need. Setting boundaries, I would already spoke a bit to that. So just kind of strategizing your time and navigating that respectfully. And sometimes that means having these conversations in advance where it could be, you know, we can stop by for an hour and that's all the time we have today. So again, being aware of your needs and triggers helps you to prepare in advance and see if you can challenge some of your unhelpful outlooks and assumptions. So this is that cognitive flexibility that I was speaking to earlier as well. Consider what you did or didn't do last year that was helpful and what you'd like to do differently. Beautiful. So this is my last sort of subject area for the presentation. I know that it's been a lot of content. Do another body scan for yourself at this point if you need to.
Eva, I do have a few questions for you. I don't know if you want to go through this
Yeah, let's do
quickly
that.
and
Sure.
then okay. I think the first one was, and I think this was from the first part in the of your conversation, was that you mentioned exercise is incredibly important. Two other foundational pieces that this individual uses are diet and sleep. How relevant are they, or is there a prioritization of those areas? Or do they all kind of go hand in hand to kind of support your own mental health?
I think everybody's going to need to prioritize that differently based on your unique needs for your body. I can think about folks who might struggle, for example, with IBS or Crohn's or other sort of digestive issues, and diet can be absolutely paramount to their well-being. Or somebody who has a diagnosis of, diabetes, that's not something that they can alter and mess with. And so I think that is, as a foundational piece, exercise, diet, and sleep are all important, but everyone's going to have to prioritize what is valuable for your system and what isn't. Some people operate really effectively on 5 hours of sleep, and other people have a sleep bank that is 10 hours a night that needs to be replenished. So that's going to vary from individual to individual. We know that at least getting your minimum is essentially important, but always operating in a deficit is eventually going to wear itself thin. And so consider what your optimal level of sleep is. And that can be different. If you're doing shift work, you might be doing a 12-hour shift. And then you actually might be working during the night and sleeping during the day, which is going to be an extra consideration for that person who's doing shift work and how they manage and regulate their sleep. And then exercise, they say if you don't use it, you lose it, and so if you're not prioritizing this in a certain way, your flexibility, your mobility will be impacted. And exercise has a big impact also on pain. Pain is not something that I talked about in this presentation, but I know that a lot of individuals live with versions of acute or chronic pain. And so if stretching or yoga or, dynamic exercises are part of how you manage your physical conditions and pain presentations, then that's going to be a priority for people who are living maybe with fibromyalgia or with arthritis or with a slipped disc in their back. And so my general answer, they're all important. But yeah, please do consider what has the biggest impact for you. And you can have fun with this and play around and take a daily log and see what has the biggest impact for you.
I can't decide if I'm more jealous of the people who only need 5 hours or who need 10 hours of sleep every night, because both sound fascinatingly valuable on both ends of the spectrum. And then the second question was from your the second part of the presentation, and that was the importance of sunlight, and you spoke to it and how it impacts all of us. Is it important for us to be in a workplace when it's a day like we've got a beautiful sunny day outside, of finding that break time to walk outside and pick up the sun and utilize that if you're in a workplace that allows you to do so?
100%. And that can be part of the organizational considerations too. In the next section is if we are considering the resilience of our employees and how this shows up at work, it's a mutual responsibility for the organization to set some of these conditions. Not everybody can rent an office space that has floor-to-ceiling windows and skylights, but if that isn't available, are there accommodations where people can bring in, phototherapy lights and put them on their desk? Or is there that space to go out is it walkable, around the building and things like that? How does the workplace tolerate breaks? It's important also, and I don't talk about this specifically in this presentation, but if we are dealing with some of these diagnoses like seasonal affective disorder and you feel comfortable enough speaking, to your organization about some accommodations that you might need to help you be successful in the workplace over those winter months. Generally speaking, a lot of folks are pretty understanding about that. And if you do need to manage your overnight shifts differently over the winter months, that might be an open conversation that you could have about how to help set you up for success and thus set the organization up for success as well when they have their best people showing up for work. So yeah, I think that even breaks are important, not just for sunlight, but just for that cognitive fatigue that we can sometimes get staring at screens all the time, or just, being hyper focused on one topic. So yeah, whatever strategies work for you, consider how that can fit in with your work demands.
Brilliant. Thank you.
Awesome. So we'll go to this final section. Basically, okay. Let me go to this next slide. My computer is gonna click. There we go. So we know that businesses today face crucial challenges. 70% of disability costs are related to mental health. Every week, 500,000 Canadians miss work due to mental health issues. Okay, so these statistics really show that it's critical to consider the impact of stress on the workplace and how comprehensive solutions that build resilience and address mental health in a whole organization can empower businesses and individuals to thrive. I break this out into two sections. I break it out organizationally and individually, because I think that it is an important sort of dual responsibility. And I think that this goes to the whole lifeline in an organization, from the interviewing, hiring, onboarding, training, ongoing performance management, timeline, as well as any transition support to attrition or offboarding. There are stress building things that an organization can do, and there are resilience building strategies that an organization can do. So prioritizing, I think, what's important for that organization and for that employee and for that organizational culture morale goes a long way. I'll let you just read through those slides. Individually, this is kind of how that shows up. Because everybody contributes to the culture at work. And this, again, you'll sort of see this flexible mindset, and resilience building individuals at work and stress building individuals at work. I will also mention briefly our CORE's relationship, again, to the chamber plan. So chamber members have the option to opt in to the group insurance plan, where they automatically have access to a business assistance suite of services, and then they can choose an optional upgrade to the EAP program. So our business assistance services have a lot of resources for organizations and employees that can help foster resilient businesses. And then further in the EAP program as well, mental health counseling sort of being a big part of how we help bring resilience building solutions. And I know that that is absolutely it for our time today. I would love to answer one or two more questions if there are any. If folks have to log off to get to their next meetings, by all means, have a little bio or stretch break before your next.
Eva, I know one question that's been asked is when you identify someone in your workplace who seems to be struggling with whether it's seasonal or otherwise, what are the how do you address that while being respectful of the situation? What are your thoughts on that?
So there is no duty for a person to disclose what they're diagnosed. There is no requirement for a person to disclose, if they have a disability or a diagnosis, even formal or informal. Let's say they haven't been diagnosed, but they're just struggling with it. But there is no law against being sort of respectful and accommodating, as a colleague or as an employer. And so I think the best way that I would approach it would be kind of that, what can we do to help? Like, what accommodations? Is there anything that would be meaningful to help shift this for you? And even if it's sort of a really open-ended check-in on how things are going, is there anything that you'd like to see changed over the winter months? You know, I don't think is a harmful way to ask the question, as opposed to saying, hey, what's wrong with you? And you could certainly say, you know, I'm curious about some of the behaviors I've been noticing lately. Is it okay with you if we have a conversation about this? I like to ask for permission, because when they say, yeah, let's chat about it, I'm open to your feedback. Or they say, no, today's not a good day, but maybe I could talk about it, you know, on Monday or something like that. That's going to give you permission to open up that door. So asking permission to share your observations, but always providing opportunities for respectful accommodation. Is there anything we can do to help? Is probably a good way to open up that conversation.
Thank you so much for that presentation. It was fantastic. I think it's so important, and the thank yous are coming into the chat now. It's so important to be aware of and of our own mental health, and I know there's so many ways that impact it, and I can only promise you that for myself, I do not have that issue of over exercising these days, but I thought that was actually fascinating that you can actually it is really about
Yeah.
moderation.
Yeah.
But thank you so much. We'll make sure that this presentation will be shared with all of our membership at the end of the week as all of our small business programming. We'll make sure any questions come in. But to our partners at Skyway, Economic Development, and to you, Eva, thank you so much for your time and energy today, and we greatly appreciate your support.
Thank you, everyone.